Before we can give treatment to the pelvis, you will need to attend for a planning visit. This visit allows us to take measurements and X-ray pictures to help us make sure your treatment is delivered accurately. When you arrive at the hospital, go to the lower ground floor where you should give your name in to the receptionist and you will be asked to wait in the waiting area. You should be seen within 30 minutes of your appointment time, but will be informed if there are any unexpected delays. If you have any concerns about how long you have been waiting, approach the reception desk and ask for help or information. You will be escorted from the waiting area by a radiographer, trained assistant practitioner or student radiographer who will then explain privately what is going to happen for the rest of your visit. There are both male and female staff within our department. You will also be asked to provide your first name, date of birth and address. You will be asked to do this each day before any X-rays are taken or treatment delivered. This is hospital policy and is designed to prevent any errors in patient identification. The radiotherapy involves the use of radiation, and we do not advise starting a course of radiotherapy if you're pregnant or hoping to become pregnant during your treatment. If you have any questions or concerns about this, please tell a member of staff. It may be necessary to go over this information with you during your first discussion. You will be informed fully about the procedure, and we will also ask your permission to place 3 tiny permanent tattoo marks on your skin, and we will show you a picture of what these look like. If you do not wish to have these done, you will have the opportunity to discuss alternatives with the staff member explaining the procedure to you. You will also be given a list of appointments for the entire course of your treatment. This gives you the opportunity to discuss any issues you have about appointments with the staff. It may help if you wear loose clothing or elasticated trousers to allow us to remove as little clothing as possible during the procedure. Most patients will have a CT scan to help plan treatment. You will be asked to lie on a specially designed piece of equipment placed on the couch, which will help to get you into the treatment position. We will need to expose the area we are aiming to treat, but we will try to keep this to a minimum. You may be lying on your back with your arms resting on your chest, or you may be on your front with your hands under your head. This is the position you will need to be in for each of your treatments. We understand that for some patients who have undergone surgery, it can be uncomfortable to achieve this position. We will try to adjust your position as much as we can to help you remain as comfortable as possible throughout the procedure. Each position is recorded so that each time you attend, you will be lying in exactly the same place. The staff will then leave the room and take the X-ray pictures necessary to plan the treatment. When the X-ray pictures have been taken, we will make 3 tiny tattoo skin marks if you have given us the permission to do so. This requires us to place a small pinprick of ink just below the skin surface. This results in a tiny dot mark on the skin. These marks will never wash off even after the treatment is finished, but if you do agree to having these tattoos, we will use them each day to line up your treatment, and you will not need to worry about washing off any important skin marks. You will not normally start your treatment on the same day, as it will need to have been planned specifically for you. Radiotherapy is a form of treatment which requires you to sign a consent form, much like you would be asked to do for a surgical operation. Signing the form indicates that you understand various aspects of the treatment and are willing to go ahead with it. This process usually occurs on the planning visit, when you will sit down with the doctor or specially trained radiographer to complete the form. We will be aiming to achieve what we call informed consent. This means that we will need to give you a full explanation of why you need the treatment procedure, and any side effects, risks and benefits associated with it. Only when we are reasonably sure you have understood all of this, we will ask you to read, sign and date the form. If you wish, you can have a copy of the consent form to keep in your records, or you may choose to leave the spare copy in your hospital notes. You may also be given written information which goes along with the explanation to help you remember what is discussed. Another way of remembering what has been said is to ask for a taped consultation. Ask when you go into the clinic if you would like a taped copy of your conversation to take home with you. During the consent, we will try to give information in the form and at a pace which suits you. You are welcome to bring a relative with you, as sometimes it is easier to remember things if you have somebody with you. Also, feel free to bring along a written list of questions to make sure you don't forget to ask anything you may have been thinking about before your visit. But if you do forget to ask something, remember you can ask someone else in the department at any time. Once you have given consent to treatment, it does not mean that you cannot decide to withdraw from it should you wish to do so. When you start treatment, you should be asked if you are still willing to go ahead with the treatment. After you have had your first planning appointment and before your next visit, the doctor and the planning technicians will use your scans to plan your treatment. During this time, the doctor will decide exactly where the treatment needs to be placed, and technicians will produce a plan to be used each day. Treatment will normally start within 1 week of your planning visit. You should report to the same reception area as you did on your planning visit, and again, wait in this waiting area. When it is almost time for your treatment, you will be escorted from the waiting area by a member of staff, who will show you where to get changed and where to wait for the treatment. Again, you will be asked to provide details of your name, date of birth and address for identification purposes. You will be called into the treatment room where the radiographers and assistant practitioners will explain the procedure. Once again, you will need to lie in the same position as you did for planning. Treatment is given by specialised equipment called linear accelerators, which can direct the X-rays to the precise area we have defined in the planning visit. After you are laid on the couch, the radiographers will use the tattoo marks made during planning to ensure that you are in exactly the same position. In order to do this, they will need to put the lights down low for a few minutes. When you are in position, the radiographers will brighten the room lights and leave the room to begin the first bit of treatment. Like the planning X-rays, the treatment sessions are painless, but you will need to lie still in the room on your own during the procedure. You can be seen by the staff on a television monitor outside the room. The first section of the treatment will require the staff to be out of the room for about a minute. Then they will return into the room and move the machine around you to another angle. The machine does not touch you at any time. Again, they will leave the room and give the second part of the treatment. On the first treatment, as well as some of the other treatments, we will also take some X-ray pictures at the same time that we are giving the treatment. You will probably not notice anything particularly different about these treatments, and we are only doing this to confirm that everything fits as well as it did when we planned the treatment. As well as receiving the treatment on this day, you will also be given the opportunity to talk to the radiographers about the treatment itself. They will offer further explanations about side effects, though these should have been previously explained to you as part of the consent process. They will advise you how to look after yourself during the radiotherapy, and you will also be given written information about this. If you have any fears or concerns, no matter how small, please tell someone. We are all here to help. As you will be seeing the radiographers on the treatment unit each day, you can always approach one of them for extra help, support, or to answer any questions you may have. The radiotherapy department also has an information and support radiographer who can be contacted on 0114 226 5282 between 8:30 and 5 p.m. The radiographer can answer queries before you attend for treatment, as well as offering support when you actually attend. They can also refer you to appropriate services, both during and when you have completed your course of treatment. Throughout the treatment itself, you will be seen by a doctor or specially trained radiographer in the review clinic, approximately once per week, to see how you are coping with the treatment and if you have any troublesome side effects. It should be clear on your list of appointments when this will be. You may also have been allocated a specialist nurse from the hospital where you were referred, and they may also be a source of help and support to you.
The Cancer Information and Support Centre is situated behind Weston Park Hospital car park and is for anyone affected by cancer who may need information, advice or support. This may be patients, relatives, carers or friends. The Cancer Information Drop-in Centre provides an informal, relaxed area for people to access information and provides an environment in which individuals feel comfortable in expressing their fears and concerns. It may be at the time of diagnosis, during treatment, after treatment, or at any time during their cancer journey. Healthcare professional staff are here to provide emotional support and guide the inquirer through the system. There are different courses available to support patient and carers, as well as access to a welfare advisor via appointments who can help with housing, employment and debt advice, as well as entitlement to benefits. Complementary therapy sessions are also available for patients and carers. Look Good, Feel Better beauty sessions are available for all ladies who have had a diagnosis of cancer. Within our information centre, we have links to other health service providers, support networks, and a wealth of cancer-related information to browse and take away. To contact us, ring 0114 226 5666. Visit our website at www.cancersupportcentre.co.uk or just call in. You will always be made welcome. We are here to help, here to listen. The Weston Park Cancer Information and Support Centre is a registered charity which receives financial support from the Weston Park Hospital Cancer Charity.